everyone, I'm Nicole Boone. Welcome to Conversations with Nicole. Today, my guest is Dr. Hillery Dolford. She is the owner of Sweetfeet Diabetic Foot Spa in Florence, South Carolina. Sweetfeet is a medical foot spa that focuses on the safe treatment of diabetic feet. Dr. Dolford, it's so great to have you on the show today. Welcome.
Thank you. So good to be here.
Absolutely. So, in doing my research, I know that diabetics face a lot of issues, and I knew that they dealt with feet issues, but I'm not sure I completely understood what diabetic feet is. Explain that to my viewers and followers.
Okay, so diabetic feet, as we know, diabetes is a disorder that affects you from head to toe, eyes, kidneys, every organ system. And so it doesn't spare the feet. Diabetics tend to have skin that is thicker, skin that is drier, skin that is prone to fungal infection, skin that cracks open easily. In addition to that, diabetics have poor sensation in their lower extremities and in their feet. So often they will injure their feet and not know it. And so this is the onset of a diabetic foot ulcer. So what we've kind of found is if we do frequent monitoring of the diabetic foot, then we're usually able to eliminate a lot of these problems. The number one problem is lower extremity amputation. You know, diabetics are at a greater risk of that because they heal poorly.
Yeah.
And so if we can get their feet in, take care of simple problems or head off problems before they even occur, then we can save a lot of limbs. And so that's just our goal here in the spa, just to bring the patients in, provide them a safe foot haven, if you will,
Yeah.
and take care of their feet.
So, talk about the procedure of some of the treatments that you do perform when it comes to a medical pedicure for your feet. Walk me through that process.
All right, so a medical pedicure differs in that of a traditional pedicure. Number one, the main piece is it is provided by a certified foot care specialist. So this is an individual that has had additional training to know how to trim nails, to know how to deal with nails that are sometimes thickened, nails that are overgrown, nails that are often attached to the skin. So that's the biggest difference. The second thing is we have a clean environment. You know, we use sanitation in between each patient. We take our implements, all of our tools that we use during the pedicure, we put them through 3 different cleanings, one of which includes autoclave. So this makes it close to sterile and as disinfected as possible. A lot of our implements are disposable. We don't share those between patients. So this lowers patient to patient contamination by far.
You know, I was thinking about your business, and I thought just a business for feet. Obviously, there's a need for it, and I'm thinking that maybe sometimes people just let their feet go, so to speak, because they don't think there's help out there. Tell me
Exactly.
more about that.
So, you know, we live in an area with a lot of obese patients, you know, patients that have lost flexibility, they have back issues, they have larger abdomen areas, and they're not really able to see their feet. So out of sight is really out of mind.
Mm.
And so, you know, we see a lot of that coming in. Patients don't know what's underneath their feet. They don't know what's between their toes because they haven't seen them for years. And
Wow.
so, you know, we bring them in, we're able to get the mirror, we're able to take pictures and kind of show them what's going on beyond what you can see. In addition to that, we have elderly patients that, here again, they have visual disturbances, they lose their ability to bend, like we talked about earlier. And so they don't know what to do, you know, for their toenails. They can't reach them. And a lot of times they're so thick, they can't deal with them. So that is a lot of what we're treating here lately. You know, it's a good mix of diabetic patients, and then there's just elderly patients and patients with really thick fungal nails that we're just able to help.
So it's kind of hard to even comprehend that people just don't know what's going on with their bodies, specifically in this case, their feet. But obviously that's the case, and you're there to help them. When they come in and they actually see what's happening, what is their reaction, and what is their reaction after you help them? I can only imagine the stories that you've heard, and the things you've seen.
Yes, we've had some great testimonials here. The first reaction, I think, is relief. You
Aw.
know, a lot of patients tell me we have looked for years. You know, I'm afraid for anybody to touch my feet.
Aw.
A lot of times, my primary care physician is too busy dealing with all of my other comorbidities. They don't get an opportunity to look at my feet. And so a lot of people are just relieved that there's a safe haven, that, you know, there's somebody trained, somebody patient enough just to care for their feet. They enjoy the process. You know, it's beyond just clipping their nails and filing them. You know, they get a really warm soak if they don't have open wounds on their feet. They get all type of topicals and emollients on their skin to make their skin feel so much better. You know, we do a good debridement of dry, thick skin. We moisturize. They get deep tissue massage. So it's really a pleasurable experience. And then when they open their eyes and look down, they can't believe that these are the same feet that they walked in with.
Well, and speaking of walking in with, when they walk out, they have to feel better, that they can actually walk better than they did before. I mean, your feet
So
carry
much.
you everywhere.
Exactly. And you know, you don't realize how much like an amputation of a great toe throws off your balance.
Oh,
But
yeah.
a thickened toenail that is rubbing against your shoe,
Mm.
or, you know, causing you pain, that causes balance disturbance. So a lot of times they're able to walk a lot better. Some of my elderly patients do a little dance on their walker as they're going out the door. So it's just so rewarding to see people get to enjoy the service and have something that they truly need to make them better.
Well, obviously, it's a much needed service. So I have to ask, how did you decide that this is what you wanted to do? Because it's very unique, very specific.
It is, it is. So I started as a nurse practitioner about 5 years ago, and my first job was in an outpatient wound clinic. We treated multiple wounds, diabetics, traumatic wounds, surgical wounds, but the diabetics stood out to me the most. So oftentimes I would have diabetics that were trying to just trim their toenails and end up with an amputation. You know, and so I said, we have got to create something for these patients to be taken care of. So in the process of time caring for those diabetics, I started to work on my doctorate at Francis Marion University. And our goal was to find a quality improvement project that would make our area better. So that is what my entire doctorate was based on, working on limb salvage through just frequent monitoring of the feet. So while I worked at the wound clinic, I developed this program. If you were diabetic, you came in with a wound and I got you healed, I never discharged you. If you had poor sensation and no pulse in the feet, I brought you back every month to look at your feet, to look at your shoes, and to make sure your nails were safe. And so we developed that. Insurance reimbursement was, you know, kind of poor on that, and we really couldn't afford to do that.
Right.
And so I kept saying, I'm going to develop a place where people can come without limit. You know, we make it affordable enough for people to come. And so hence we've just grown into a whole business taking care of diabetic feet.
That's amazing, Dr. Dolford. That's really quite the story. And it's awesome to know that you studied right there at Francis Marion University, and you're bringing your skills and your intelligence and your caring heart to the people in Florence and surrounding areas. That's quite the story. So you don't take medical insurance, but you do say that your services are affordable. And so that's awesome, you know?
Yes, ma'am. And so many of my patients, a lot of their children will, you know, cover the cost for them to come. We do offer some indigent services. You know, my heart is to take care of people. I have to make a living, but in the
Sure.
same And whatever I can do to keep you safe, we are able to do that. And business has been good. Patients have been faithful coming, and the word is getting out, and so we're just able to kind of keep this going.
And you also said you don't have to be a diabetic to come and get your services. So if you want a pedicure in general, you could come to your office. Is that correct?
Absolutely. I have a good bit of women, men that are not diabetic. They don't have any issues, but they want a safe environment.
Yeah.
We do mostly appointment only. And so while one patient is coming, one patient is leaving. You're not tasked in the pandemic of being in a full spa with a lot of people. And so people really like that advantage. You walk in the door, it's limited waiting, you
Yeah.
have your treatment, you're in and out and on to your busy schedule.
Well, I love a good pedicure, so I know how good I feel after I have one, and I can only imagine how your patients feel after they come in and they are treated with your expertise. That's wonderful. So now, listen, you have some exciting things happening this month. You have a relaunch of your business, so to speak. You're in a new location, a ribbon cutting coming up. Tell me all about that. It's exciting.
So we're very excited. We started in a one-room spa, one patient at the time. And thank the good Lord, we have grown to a building that's about 2,000 square feet. We have an open spa for patients that don't have any issues. They're not foot shy and don't mind being out in the open. And in addition to that, I have a medical room. So sometimes I have gentlemen, sometimes I have patients with really bad issues that feel uncomfortable. So we go in a private setting, one-on-one. Nobody sees their feet but me, them, and the good Lord. And we're able to provide their service there. And so, we have a couple of openings coming up. We have a soft opening that's geared towards physicians and healthcare professionals, and they'll get to come in, hear the story of Sweet Feet, get some of our literature, find out how to refer, how to get your patients here. And in addition to that, we will have a grand opening with a ribbon cutting with the Chamber of Commerce. And right after that, we're going to have an open house where we invite all of the public to come in, tour our spa, see what we do, see some of our before and after pictures, and just help share the news.
That's wonderful. And tell folks where you're located.
We're located at 2724 West Palmetto Street, Suite 3. We're in the Madison Plaza, and that's right across from Cal Yarborough Honda dealership.
I know where that is well. Well, listen, this has been a wonderful conversation about what you're doing to help those who have diabetic feet and other feet issues, and then also those that just want to come and get a medical grade pedicure. You're doing amazing things there in Florence, South Carolina. Anything that you want to share before we say goodbye?
I would just like to extend an invitation to everybody. Come out and cut this ribbon with me. Come to the open house. Again, that's March 30th. 11:30 a.m. is the ribbon cutting. And then from 12 to 4, we'll have an open house. We're going to have free giveaways. We're going to have treats, a ton of information. So just come out, show your love, show your support, and just learn about our brand.
100%. And folks, I'll make all the information available in the description for their website and Facebook page, and how you can read what is affectionately known as Doc Hill, correct?
That's it. Everybody calls me Dr. Hillary, and I love it.
Well, listen, thank you so much. I appreciate you being with me today for Conversations with Nicole. It sounds like you're doing amazing things there with Sweet Feet in Florence, and I really appreciate your time today.
All right. Thank you so much, Nicole.
You are welcome. And folks, that's going to do it for this edition of Conversations with Nicole. Until we see you again, we hope you have a great day.